So Dana from Palm Springs asks, why do other doctors not provide the All-on-6 procedure? I think there are a lot that are leaning towards, or there are some that are kind of changing their tune and changing their tone regarding the All-on-4, because if they've done a lot of them, they've seen a lot of complications and a lot of failures. But the reason that they would not offer that generally is because they don't know how to deal with doing implants beyond the sinus or beyond the mental nerve. And so that requires surgical skill set that is taught and trained, and you really can't gain that skill set outside of a university-based training. You can't really get it in a 3-day weekend course or something like that. And so the All-on-4 is very safe because it avoids a lot of anatomical structures, but biomechanically and for the long term, it does not work like the procedures where you have more implants.